One of the things that makes being a hand surgeon so special is that I get to work with principals from the different disciplines of orthopedic surgery, plastic surgery, and neurosurgery. As a hand surgeon, I get to work with patients from all walks of life. I specialize in treating patients that have complex nerve injuries, so I do operate all over the body. Sometimes I'm working below the elbow, but a lot of times I'm working in different areas to try to treat nerve injuries in the brachial plexus, which is closer to the neck, and also out in the lower extremity as well. I think it's really important for all of us to remember what it's like to be a patient. And some of us are further away from that than others, but all of us have had family members who are patients at some point or another, or been in the dentist chair, for example. So I think remembering what it's like to be a patient is really important. So whether it's being the patient who's about to have surgery and you're real nervous and you just want a reassuring smile and somebody who's going to let you know that it's going to be okay and that we're going to do our best for you, whether it's being a family member and knowing that somebody's going to talk to you after the surgery and tell you how things went. I think that's being centered in that way is really important to how I take care of patients. And I think that it takes a really compassionate approach to trying to understand not only the medical aspects of it, but how we can work in a multidisciplinary fashion to ensure that your outcome in the operating room is optimized. And that starts from before surgery to obviously the day of surgery, but most importantly in the months following the surgery, because all the work that we do in the operating room can really be fine-tuned with hard work with our physical therapists and hand therapists. So I try to incorporate that from the very minute I meet a patient, is trying to understand what it is that the patient wants, what it is that the patient expects, and how I, as not only their surgeon, but as their doctor, can coordinate all of these efforts to try and get them the outcome that they want. Washington University Medical Center and Barnes-Jewish are incredible institutions. It's very hard to find an institution that's so centered on patient care, and it incredibly values research and teaching in addition to providing excellent care. I think there are very few centers in the country, let alone the world, that allow experts in their fields to work so closely together while still allowing them the leeway and the time to do research and teaching, which is so valued here.